Thanks, Jennifer, and thanks again to Jan, David, Andrew, and Christina. I'm so pleased to have been asked to moderate tonight's discussion. It's incredibly timely and an important topic, and we're just going to wait for our speakers to join us and start the Q&A. If you have questions, you can submit them during the chat, and looking forward to what's going to be a great conversation. Got everyone on screen. David, I wanted to start with you. You talked a bit about the fourth distinction, or the lack of the fourth distinction, and I wanted to know from your view why such a significant gap exists in the national strategy when it comes to Indigenous housing.
You know, that's a question a lot of us in the sector have. And I think it's probably due to CMHC's traditional dealings with on-reserve folks more than anything else, although notwithstanding CMHC brought out the Urban Indigenous program. So it's a bit of a dichotomy in my mind as to why they were so there in 1978 that they realized there was a tremendous need for this program. And it's really one of the best programs, if I can use that word, in social housing. There's many programs in Indigenous and mainstream social housing, but the Urban Native is highly regarded for the insight that the folks who created it had. So it's a bit of a mystery. Maybe all those people have retired by now, but don't know why.
You sounded a bit optimistic when you said, the federal government is coming back into housing. And I mean, do you feel like, you're pushing for this distinction? Do you feel like you're getting traction on that issue?
Well, as I said, just in the last really half of this year, people are listening. We're pushing very hard. And, we have some champions out there. And I think Evan Siddell is probably one of them. Mr. Vaughan, MP Vaughan in Ontario, they are lobbying for us. So we've noticed as of late that there's more traction, and we got great advocates like Margaret Foe and Justin Marchand in Ontario. Margaret Foe is CEO of AMA here in BC, and of course. In Mr. Byers in Regina, who's the chair of our working caucus, Robert Byers. So those voices are starting to get traction. Yeah,
I am glad to hear that. Now I'm going to bring it down from this giant overview down to microhousing and take it over to Cristina. You talked a little bit about sort of microhousing in theory. But I wanted to explore a bit some of the practical examples that you're seeing of microhousing for people who might not be familiar. And this would be sanctioned or unsanctioned. And please go ahead.
Yeah, I mean, for anyone who's tuning in from Toronto, I think the example I'm going to give is probably going to ring true. So in the last week, there's a Toronto-based carpenter, Khalil Severite, who's been building shelters for free for homeless folks in the city. And in the past week, the city has been threatening to, remove these shelters, remove them at cost to Khalil, who's the person who's been putting this up. And alongside with this as well, we've also seen a bit of an attack on a lot of community-based efforts, community fridges in Parkdale as well. And all of these sort of the legal issue around this is municipal bylaws around land use. That's essentially the city's line on why these things can't happen. So in a practical sense, I do think if anyone was pursuing a kind of small, modular, tiny type of housing, that would probably be one thing that they would have to strongly address. And in the article, I talk a little bit about a better tent city in Kitchener-Waterloo. And I spoke with one of the architects of that project, and municipal bylaws was probably the most practical thing that kept coming up over and over again as a barrier.
I'm actually excited to come back to bylaws, believe it or not, and I am going to come back to that. I wanted to ask JM, just talking a little bit, I mean, you've mentioned, we know about the great project, the collaboration that happened in Parkdale, and now, we've got the CMHC is buying in. I wanted to ask a little bit about the private sector and what you're seeing in terms of sort of big money donors or banks when it comes to these new financial models for housing.
Yeah, I think there are a couple of investment vehicles out there, but not a lot, right? So I think that's one of the opportunities that that we have as we come out of COVID, particularly, is to have our governments play a role in sort of backstopping investment, but allowing more private investment to come into this part of rebuilding our economy, of dealing with affordable housing issues. Because I think it's been, unless the land is owned by a government entity, it's very difficult for the private sector or private developers to, make the math work. So there's got to be ways that we can have government play a slightly different role so that we could be better positioned. Certainly credit unions and values-based banks like us are in the space, but I think there needs to be a lot more money coming into it and a lot more interest in making it happen at a faster pace.
The land piece is really interesting because I always sort of imagine big money investors wouldn't have a problem acquiring land, but in urban environments, much of it is owned by the city and the province. And
That's right.
Just quickly before I go into Andrew, I mean, the model that you're using, how easy would it be to scale it up?
Well, the model that we put into Parkdale was exactly a model that we want to be able to scale. So we think the idea of a not-for-profit owning land, buying land, keeping land in community, making sure land stays within the community with the intention of having places for people to live forever, we think is a brilliant model. And so we think there's opportunities to scale that. We've worked with a number of other types of developers who have other models like Habitat for Humanity and others. So we think there's a number of different models that are working really well. We just have to figure out how to scale it.
Thank you. Andrew, I'm coming down to you for the last, well, I guess of round one. And before we get into the systemic discrimination piece, which I think is an incredibly important topic, I think I was just hoping you could sort of root us in what it's actually been like for healthcare workers who are seeing the results of systemic discrimination and poverty and the rise in cases of COVID.
Yeah, I mean, I think it's just really important to be grounded, I think, with the humility that, yes, healthcare workers, my friends, colleagues, myself are tired. But I think the last part of your question, caught me as well about the systemic discrimination. I think we've seen it really play out in long-term care homes for women working as mainly as personal support workers, and how racialized and how much structural vulnerability and discrimination has taken place for people who've been working in long-term care homes. So I really, I think for, where I'm situated on University Avenue right now, I think, looking across at the hospital and colleagues who are working in the emergency department and the floors, just huge amount of gratitude. And I think that there's a sense of fatigue, but not in the way that it's about the work, but I think the disconnect from what we're seeing take place coming into hospitals, but also out in communities, and the action that's not happening to help, where we know what's driving a lot of these rates, a lot of the COVID rates, but a lot of the hurt and the suffering. And I would also be remiss not to give all of our love and solidarity to shelter staff and essential service workers. I think healthcare workers have done a huge amount of lifting and will continue to and have, but there's also been so much that's happened where we've seen people before that we labeled as minimum wage or unskilled labor who have really helped propel us through the pandemic, have continued to and had risked their lives and continue to without the sort of PPE and protective equipment and supports that some of us in hospital get, and even some of us in other settings where it's not as readily available. So I just think that that's a piece where we're all feeling that heaviness. And I think we have to break down some of those divisions between the hierarchies we've seen in the healthcare space.
I'm going to come back to you with the piece about hierarchies, but we've got an audience question, and you effectively answered most of it, but just talking about the connection between, housing and other social determinants of health, or how vitally important it is that someone has housing. Or what does it do to their health if they don't?
It's sometimes hard where we are in the pandemic, and I have full respect for the question and the questions that have been there about housing and health. It is so fundamental. I mean, you cannot have health in this country and society without housing. And the fact that we've allowed this to go on for so long pre-pandemic only speaks to the roots and the reach of systemic discrimination, that we have been okay as a society or country that some people will have access to housing and too many will not. And I think, again, I would really push on us not to think as people as infectious vectors as to why we're now thinking about rapid housing initiatives and wanting to say that, okay, to keep everyone safe, we should be able to have people isolate and have housing. But once the pandemic's done, we can go back to accepting the rates of homelessness we have. I think it's been great to see some doctors push for COVID zero to get to that. I think it's great, but I think we should have that same audacity to get homelessness to zero, both now, but through the pandemic, if we actually are serious about seeing health equity in this country.
Yeah, absolutely. Someone has sent a question for Cristina, and this is a little more architectural. Honestly, just, saying, it's a great idea about building, small shelters or environments, but in a climate like ours, aren't, shared walls more economically and environmentally sound when it comes to heating and cooling? And I respect the question, but I think I do want to go back to the idea. I think we were touching more on the idea of, building emergency housing for people, but I'll let you answer that.
Yeah, I fully agree with whoever asked the question. I'm personally not in favor of tiny living or modular living as a large-scale social solution to housing. And I appreciate any effort that is looking to ameliorate people's quality of life, like Khalil's effort in building these shelters. And I wish the city would respond positively, because I think the short-term impact would be outstanding. But yeah, most research shows that high-density urban living is the most sustainable from an environmental standpoint. And similarly, like just thinking in the conversation about what would even make a tiny or modular living sustainable or workable, I think you would need a subsequent investment in, public service and public infrastructure. Because if you're going to live in a 200 square foot space, you're going to need access to transit to get you around, public parks to spend time in, libraries, childcare. I think a housing strategy that's paired with a strong public infrastructure investment would make the most sense and be the most sustainable.
Jan, can I go back to you for a second? I mean, I know about the project in Parkdale, and I've talked to them about the rooming houses. What are some of the other examples of sizes of housing that you're investing in?
So we've invested in very large condo complexes where there's an affordability component to it. So Options for Home would be an example of that, or Trillium, that are building multifamily units that, there's a measurement of how you can afford to do this, and then they kick in. So there's a second mortgage for home ownership. We've invested in facilities that are set up for people with some sort of ability issue. So we've I think all of them would be multifamily, and they would be different sizes depending on the developer and the project and the not-for-profit that's leading it.
I think we had a question from an audience member just asking you to weigh in on on inclusionary zoning. But I mean, I think it's my understanding, and correct me if I'm wrong, I mean, you're dealing with an entirely different structure. You're not just dealing with that. So for those who don't know, inclusionary zoning is effectively a developer agrees to have a certain percentage of units be deemed affordable by the CMHC rules. And it sounds like the projects that you're doing are free from those constraints. So you're building strictly affordable housing, not a percentage within.
We're financing affordable housing. We definitely think there's a role to play in helping those private developers do that right.
Okay.
The idea that you have within each project permanent affordable housing, because I think one of the challenges with the way we do it now is that it's affordable for a time and it's not permanent. So I think there's a way to kind of work with developers, work with municipal governments, work with others to figure out, because I do agree with Cristina that the best solution is a solution that is multi-tenanted, multi-factored, community-based, that has all different types of people living in it. So I'd like to see models that have permanent housing as part of the developer's requirement.
Just Andrew, I wanted to take it back to you before it dropped off. I mean, we were talking again about, discrimination, and particularly in Toronto, we've been seeing public health numbers get released that show that people in, diverse communities are more deeply affected by COVID. And with the winter months actually upon us, I'm wondering if we could just think of concrete solutions. what would you suggest, or what do you think government could do to remedy that inequality quickly, so we don't, have them disproportionately affected during the second wave?
Yeah, and I think just one of the things to add, I mean, as much as I was saying as well about people working in shelters, harm reduction workers, our community health workers that have been so vital in the response, it's really has to be framed the fact that we are seeing crisis upon crisis upon crisis. We've had an overdose crisis, we've had a homelessness crisis, we have the pandemic, and we have had a crisis of racism, of structural racism, longstanding. And so for certain individuals, we're living in the compounded conditions and states that are being imposed on them. And then we're asking questions about, can people be healthy without housing? And for the reality of people on the ground, I mean, it's unconscionable to be able to be where we're at. And I think when you look at the questions, that have put forward, and I think to Christina's comments about, the encampments or the city tents that have come up. And I know that it makes certain people, look at it, feel uncomfortable, and they don't like the look of tents in our city. And to me, though, that's just the push that we actually have to move on these solutions with all levels of government. And I think it speaks to the fact that you ask about what can we do around patient populations who've been discriminated. We have a provincial budget that's coming out with no mention of supportive housing when we have a homelessness crisis. So it's one thing that has to move. I think the province has to work with the feds and work with the city to see the rapid housing initiative become even more rapid and more mobile to move more people into housing options. And I think we've seen today, actually, with some of the data that was presented at the science table for the province, that more income supports would be hugely helpful. Paid sick leave is something, again, that we've seen a reversion a few years ago, and now we have people and asking them to stay home or get tested when we don't have paid sick leave in this province. And again, I think on issues around ensuring that there is housing that's available and supports, and it goes beyond just these temporary measures where we're then expected to have people go back to streets or shelters and say that, we've done enough to make sure people are safe as vectors, but not as human beings, and not delivering on housing as a human right.
Yeah, as an opinion, I would say that I think a little discomfort is good for people, and I entirely agree. It's such an enormous question, and sometimes I think it's interesting to try to just pick one slice and see if you could actually fix that one thing. And this actually ties into a question from the audience that I think can go to David. And effectively, they were asking for, one example of, say, an intergenerational model of housing that you've seen have some success. And I'm guessing one of your projects probably has that in it.
Yeah, we in a lot of our family buildings, there are, a significant number of elders in there as well. And the interaction with the elders and the children are the best example of where that would work well, because the children then are exposed to traditional ideas and concepts. And just listening to an elder, and if you look at children, I have 3 grandchildren, and they look at me, I know, differently than their parents, for an example. And most of us who've reached my age realize that. So there's a lot of automatic respect and love that goes to an elder. And I think that there's also a common language between elders and children, grandparents and grandchildren, that makes the learning process simpler and more valuable and more authentic. So with those situations where you have families and grandparents, parents, and children in a community as well, what's really important is, the bricks and mortar are there for security and for a place, but what is really valuable is the community. So if parents of some children are having a rough time of it, and some of that is visited on the children know they have friends, they have other parents in the community that they can go to, because over a period of time, that's what happens. People mix and mingle, and so you get the advantage of community. Hard to really evaluate that. It's like the social return on investment that affordable housing brings. It's hard to put a number on it, but it is huge.
I don't think you can really put a dollar value on something like that. I would really like to see my grandmother right now. I would like to see my parents right now. I think all of us could benefit from a little intergenerational living right now.
Yeah.
And that kindness.
That isolation it's not good. It's I just have a hard time with so many of the care homes where you're not allowed to visit your parent or your elder uncle or that sort of thing. It is not good for their health. Simple as that.
I mean, I guess we sort of strayed slightly into the idea of supportive services, or talking again about the value of emotional and, medical, all of the supports needed to deal with this many decades long crisis when it comes to people's physical health and mental health. I wanted to take it back to Jayanne for a second. So when you were working with the Parkdale Neighborhood Land Trust, I mean, I know their structure is deeply built around the idea of deeply supportive housing, or making sure that, those residents are part of a community. Is that something you try to apply broadly when you're looking at buying in or, building new homes?
I think the idea of, well, community is in our name, Vancity Community Investment Bank. Community is what we try to make sure the money is going towards as we look at how we finance things. Because I agree with David and with Andrew and with Cristina, like without community, things would be even worse. And with community, when you see communities rally, you see, success economically, socially, and generationally. So I think the idea of community and really tapping into community, I think is something, like you said, we're all missing it so much. Maybe we forgot how important it is. But as we recover, we need to make sure it's definitely a cornerstone of our recovery efforts. So
I hope so. And this conversation could go on a lot longer, and I actually really wish that it could. But I guess we have to wrap up. And I just wanted to say thank you so much to our speakers for taking the time. Thank you to the Walrus for putting on this great event.